Okay, once again, I know some people were just getting settled. My name is Leanne Foster, and I am a member of the Provider Outreach and Education team. And I want to welcome everybody to the first event in our Medicare Madness events today, which is focused on the life cycle of a claim, start to finish. So our first session today is navigating the dark forest of Medicare provider enrollment. And you might be asking what provider enrollment has to do with the life of a claim. The answer to that is, it is the first step in being able to submit a claim to Medicare. Without enrolling in Medicare, a provider cannot bill Medicare directly for their services, so you can't even submit that claim. So our objective today is to help improve your understanding of the provider enrollment process to make it easier to navigate. Provider enrollment can certainly be a complex process. We understand that, and there are reasons for that. We'll talk through those today. We want to help make that easier for you. So to accomplish that, we're going to talk about the PE process, including what you can expect during the process and how to move through that process more efficiently so that there are either no or fewer surprises in that process. You understand some of the whys behind what we need to do. I'm also going to be providing information regarding our provider enrollment chain and ownership system, or PECOS, today. Now, PECOS is an electronic enrollment system, and we did receive a lot of pre-submitted questions about step-by-step and how to submit those applications. That's certainly going to be an educational event in itself, and we do have some of those events. We are talking about PECOS, and we're going to give you some tips and tricks through that. But I'm also going to be providing you with some resources and where you can find some videos that are going to take you through step by step from registering for access to submitting that application to help you better utilize that PECOS system. We're also going to talk about items that we commonly develop for. Those typically we see a lot of the same things that we need to develop for. Sometimes that changes, but I'm going to talk about the most common items that we develop for and help you avoid missing those so that we don't have to develop those. If we can have an application that requires no development, the enrollment process goes much more quickly and smoothly. And then finally, I am going to be providing some tips of how to make this process a little bit more smooth. We have received a lot of pre-submitted questions on that, so we are going to go ahead and talk through some of those as well. I will be using several acronyms today. I'm not going to read these through, but the presentation was emailed to you yesterday if you had registered prior to today, but it was also sent again today so that you have that slide deck and you have these acronyms should you want to leverage those today. So let's get started with navigating the provider enrollment process. So as I stated, one thing that people often do not think about is that the provider enrollment process is the first step in the life cycle of a claim. As I said, that's because a provider cannot bill Medicare directly until they have completed the provider enrollment process and they receive their provider transaction access number, or PTAN. The only way to get that PTAN is to go through the provider enrollment process by submitting a provider enrollment application and providing us with a multitude of details. We need to know about the provider. We need to know who's going to be billing us. So one of the critical roles provider enrollment plays in Medicare is fraud prevention. The best way for us to protect the Medicare trust fund for future beneficiaries is to keep those who would do harm to the Medicare trust fund from gaining access to those funds in the first place. So another way of thinking it is provider enrollment is kind of the gatekeeper to that trust fund. Nobody's going to be paid without having been vetted. So fraud prevention is a key focus of provider enrollment. So we ask for a lot of information. That's not arbitrary. There are reasons for that. We are vetting those that we will be receiving payments. So the type of things that we're looking at when we do that, we're responsible for verifying a provider's qualifications. We'll talk about who can enroll in a minute, but not everybody, simply because they're providing services, necessarily qualifies to bill Medicare. CMS does set what services are payable and what providers can perform those services and bill for them. So we are verifying those qualifications by looking at providers' licensure, making sure they have the appropriate licensure, making sure that they are licensed to the state in which they're practicing. And we're also looking at certifications. Now, with certifications, it may not be something that's necessary for all provider types. Not every provider's requirements are the same, but we will show you where you can find those qualifications so that you know what's required for a particular type of provider. We do also verify all address information. So address information plays a key role when you get into the processing of the life cycle of a Part A or a Part B claim. Practice locations and address informations are built into that claims adjudication system. That claims adjudication system is built through by PECOS through Provider Enrollment. So Provider Enrollment is building those records that claims are processing off of. And with address information, think about things like fee locality. We need to know where services are going to be provided in order to pay them appropriately. Fee localities are different based on geographic location. So that's one of the important things that Provider Enrollment is also looking at. Provider Enrollment is also responsible for collecting bank account information. We pay all of our providers electronically through an electronic funds transfer process, and we need that bank account information, and we need that on file, and we work with our other areas to make sure we have that correct information on file and that everything's going to go smoothly when those first claims are coming in. So again, just coming back to Provider Enrollment is really building the provider files in our claims adjudication system, and without that information being in there, claims will not process. Provider Enrollment is also confirming that all CMS requirements are met. This is tied to qualifications a little bit, but depending on the service, there are different requirements, even for, say, an organizational structure. We need to see those requirements are met before a provider can receive that P10 and get paid. So the next question is, who can enroll? So Medicare covers services that are medically necessary and reasonable for patients. Medical necessity is the thing that drives whether or not a service is payable. But that just because that service is medically necessary, we do also need to know who provided that service. And not everybody in the healthcare field is necessarily eligible. Now, there's a wide range of providers that are eligible. Medicare eligible providers include physicians, non-physician practitioners, suppliers. And when I say suppliers, we're talking about labs, we're talking about ambulance services, independent diagnostic testing facilities. We're also talking about organizations such as group clinics. When we're talking about facilities, so we're talking about our hospitals and those that would bill on the UB04. So those are the types of providers that will enroll. Now, Medicare does lay out the providers that are eligible to enroll in both the Code of Federal Regulations, or the CFR, and the Medicare Program Integrity Manual, or Chapter 10. I'm going to take you out to Chapter 10. That is going to be probably the simplest. The other thing that you're going to know that I want to point out is Chapter 10 is essentially the manual that provider enrollment and that process lives and breathes by. That process is very transparent. CMS does lay out the expectations of qualifications for the providers, but it also lays out certain most contractor responsibilities as well. When I say most, there's some internal clerical that we get to decide on our own as a MAC. But when you come out to Chapter 10, and I have included a link in the presentation today, when you come out to Chapter 10, this is the PIM. This is everything provider enrollment. And you will actually see that they lay it out by provider enrollment application that you're completing. And it's a list of the providers and entities. I'm going to scroll down to the 855I for the individuals, the specialties that are eligible to enroll. By going to these sections, I'm going to go to physician assistants, for instance. What you'll see here, it'll not only give you the CFR reference, but then it's going to go through the requirements that MACs are required to look at in order to enroll that particular specialty. So we did receive some questions about enrolling a nurse practitioner and physician assistants and their qualifications. This is going to be a really helpful resource for you if you're looking for what qualifications they need to meet to be eligible to enroll. We do have some resources on our website as well, and we're going to show you that in a few minutes. So next I want to talk a little bit about just the overall enrollment process. So at a very high level, it involves, first things first, you do need to obtain a national provider identifier going through the NPES system. That 10-digit number is the number that is used to bill Medicare. The PTAN that we spoke about that you're enrolling for, that is what's going to contain all of the qualification information as far as licensure and certification, address information, tax ID information, bank information for the particular practice or setting that you're enrolling for. So if you do not have that MPI, that is going to be something that would be developed for. Oftentimes, I think we find providers might find they have their MPI, they're enrolled in Medicare. The MPI is an enumeration system. It is not something that is precludes the provider enrollment process. That MPI is meant to be used nationally to make billing for providers simpler. Once you get your MPI, you are set to submit your CMS 855. You can submit those either electronically through PECOS, which we'll talk about, or utilizing a paper application. You're going to hear me talk about this, but I'm always going to recommend that you submit through PECOS. It does make the process easier, more efficient, and it allows you to have more access and insight into what information is on your enrollment record. So once that is submitted, it is reviewed. If there is any development that needs to happen, a letter may be sent out. Once that development is received, provided that it is received timely. And just as an aside, development, you do get 30 calendar days to respond to that development. If you do not respond, or you do responding incompletely, it is going to be something where we will reject the application and you may have to start over. So I just want to shout out to everybody that if you receive a development letter, it's not the end of the world, but please make sure you're responding to those timely. Once we have everything and we have vetted the provider and ensure that they meet all qualifications, a PTAN is assigned, and at that point, you'll receive a notification and the provider is ready to bill. So that is a very simplified version of the enrollment process, but that is really what there is to it. There are some side jumps that can happen as far as, again, if there's development. This is the process that's used for initial enrollments, changes of information. If somebody has a change they need to report. If somebody is reassigning benefits, they're established, but they're reassigning to an additional group, it is the same process. The other questions that we've received are about revalidations. Revalidations go through this very same process. It's just how that application is completed. Now, I mentioned submitting applications. There's two ways to do it. We did get some questions about whether or not there was an electronic way to submit the application. The answer is yes. You will submit through PECOS. That is a CMS system that is essentially, I always equate it to some of the do-it-yourself tax filing software. It's going to ask you some questions, and we'll show you that here in a few minutes. But it's going to ask a series of questions to identify who you are and what you are trying to accomplish. And then it's going to bolt together the topics or the sections of the CMS 855 application that apply to you. The other option is through paper applications, and I've provided links to both the PECOS system and the paper application. The paper application is a PDF template, and you can complete that in the online template. However, you cannot submit that paper application electronically. A paper application would then need to be downloaded, need to be signed, will need to be mailed into our system. It'll need to be scanned and ingested. It has to go through our mailroom process and ingested into our workflow system for our enrollment analysts to start working that enrollment process on it. Now, I'm going to encourage you to try PECOS if you haven't tried, and we will be giving you some links to some step-by-step videos that are going to help you register and submit applications. PECOS is electronic. It allows us to leverage some automations, both for verification and data entry, and it really speeds up the process. So for PECOS, if you submit something electronically, if we do not require any development, again, that can extend the processing time, but if we have what we call a clean application, we have everything we need, a PECOS application, CMS expects us to process those within 15 days. With a paper application, because of all of the manual tasks that are still involved in that, and we've certainly streamlined it as much, but CMS allows us 30 days to process a paper application. Also with PECOS, your development, you can make your changes if we need something adjusted or uploaded. That can all happen through PECOS. With a paper application, you're going to have to send or fax that back in. So again, it's more efficient to do PECOS. The other reasons I would recommend PECOS, if you need to see if something needs to be changed, if you need to know what's on your enrollment record, if you've submitted electronically, you are going to be able to see the information that we have on your enrollment record in real time. With paper applications, that is not an option. If you've been submitting paper applications, you can start sending electronic and you will gain that. Particularly with revalidations, PECOS is a lot simpler because there's a lot less manual work on your end as well. Again, paper applications have to be mailed. They cannot be faxed or emailed, and they aren't something that can be submitted on our website, and that is intentional. CMS does want people to go through PECOS. Now, I just happened to catch something in the chat, and I do want to address the questions about PECOS 2.0. Tom, thank you. I know you responded to that as well. But with PECOS 2.0, that is something that is delayed. We are currently continuing to function in the current PECOS system. We do not have a go live for that, so we will not be talking about PECOS 2.0 today. All right, so now we've talked about the process a little bit, the applications. This is the hard part. Which way to go? Well, it depends on what you're trying to do. So with provider enrollment, there's a couple of things that you can do. You can submit an initial enrollment. Now, an initial enrollment is if you have a provider who's new to the Medicare program as a whole. Maybe they've not seen Medicare patients before, maybe they're just graduating. An initial enrollment can also be when a provider is enrolling in a new jurisdictional state. We received this question a couple of times in the pre-submitted questions where a provider is enrolled in one jurisdictional state and maybe they're practicing close to the border. This can happen a lot for us with Michigan and Indiana and our J5 states. Kansas and Missouri comes to mind there. There are cities that are on the border where the provider might practice in both states. They do need to enroll separately in each state. And so if they are practicing in Indiana and now they're going to practice in Michigan, for example, they are going to need to submit an initial enrollment. And that has a lot to do with how that claims adjudication system is set up. There's fee localities at play, and so those systems are separated because of the way the payments are adjudicated. So that is what qualifies as an initial enrollment. Next, changing of existing enrollment data. This could be a provider's name. This could be address information for a clinic or a supplier. This could be contact information. This could be an established provider who's currently working for a group, so they're reassigning their benefits to their employer. And just want to clarify, a reassignment is you have Dr. Smith working for ABC Medical Clinic, and ABC Medical Clinic is going to bill for Dr. Smith's services. Medicare will pay ABC Medical Clinic, and ABC Medical Clinic will pay Dr. Smith. So it's an employment arrangement. Providers can work for multiple groups. I have seen providers that are maybe filling in, say, in emergency departments or different types of facilities that have 10, 15, 20 PCHANs. It's completely possible. But every time they are reassigning to another clinic, they do need to submit a change to their existing enrollment data to add another reassignment or possibly remove a reassignment that's existing if they're moving from one clinic to another. Also, revalidation, we talked about that a little bit. A revalidation is recertifying all of the enrollment record information that we currently have on file. This is something that happens every 5 years to all providers that have active enrollments, and we ask to revalidate all of their enrollments. It can also happen in an off-cycle setting if there's something that prompts it and CMS communicates to the MAC. It can be a regulation change, it can be an uptick in fraud in a certain geographic area or provider type. But if you receive a request for revalidation, that is something that you will get a letter on and you will need to respond to. And then I also mentioned deactivation. So a deactivation is if you have a PTAN number that you're no longer using, maybe a provider left your clinic, perhaps you have a provider who's retired. We do want to make sure that we're deactivating those and putting an end date on them that protects the Medicare Trust Fund by making sure that we don't have active numbers out there that are dormant for someone to find and use fraudulently. So again, another piece of that fraud prevention. So which way to go? GPS, a roadmap would be great. So we do have that out there for you, and I've included a link here. If you'd like to navigate with me, that's totally fine. We do have a provider enrollment decision tree, and the decision tree is going to ask you a series of questions, and I'll go out and demo that in a second. But it's going to provide you with application guidance, and it is going to be scenario-based. It can be used for both electronic and paper submissions. So I would encourage you before you submit an application to check this out, to see what you need to do, and then you can decide to do it electronically or through paper. Again, I'm always going to advocate for doing it through PECOS. And then you'll also find that as you go through this, we do have resources available to various provider enrollment links. So I am going to go out to our website. And Mary Sue did put in the chat a link to the decision tree. I'm just going to show you how to find it without the link. Under our topic center, we do have a guides and resources page for provider enrollment. You do have a link to this page as well in your training materials for today. There's a lot of good information out here. There's information on development, there's information on revalidation, there's information on PECOS out here. I like to go to A to Z so I can just see all of the items that are out here. And you can certainly search. I just happen to know that the decision tree is right down here. So I'm going to go ahead and click on that. And this is what our decision tree looks like. So it's going to ask you questions. What are you trying to do? And we just talked about the different enrollment actions. So I'm going to go there. You'll see here that you start seeing these links to checklists, to how to choose the appropriate application, and then just some helpful steps to a successful enrollment application. So the first thing we talked about was you have to have an MPI to enroll, right? So that's the first thing this is going to ask you. We're going to say, yes, you have one. Actually, just for argument's sake, I'm going to say no. It's going to tell you to get an MPI, and it's going to give you a link of where you can get that. And then you're going to have some options. I'm going to start over. Take another enrollment action. Let's say I have an MPI. It's going to ask you if you are trying to enroll in one of our jurisdictional states. If you say no, it's going to take you out to the jurisdictional state resource so that you can find the MAC that you need to submit to. And then here you will see a listing of those Medicare eligible providers. And here you'll also see that we have links to Chapter 10 and the references for those specialties. So we did get a lot of questions about the qualifications for specific specialties, and they are listed out here for you to find. I'm going to do a clinic owned and operated by a professional. So here it's going to ask if this clinic is solely owned. We did get some questions about solely owned clinics, which is a group or clinic that's owned by one individual and they have an incorporated tax ID. This is the path for you. That is going to be a situation where that clinic will enroll under that incorporated tax ID, and then that individual will also have to enroll. And we're just going to say yes. But here it will walk you through what needs to happen, and it will provide you with additional links. Now, for the sake of time, I'm going to end this particular demo, but this is something, if you're trying to determine which way to go, this is something that I would encourage you to check out. So which application? Now that decision tree is going to help you determine that, but I want to talk about this. We did get some questions on the differences of the applications. So the first application I want to talk about is the 855I. That I stands for individual. So this is going to be your physicians, your non-physicians, that are going to be billing Medicare directly. The 855I is also what you use to report a reassignment. But a couple of questions asking about the 855R. That is a form that has been decommissioned. That was a form that was strictly for reassignments. However, that has been incorporated into the 855I, both the paper application and PECOS. One thing I didn't mention, I do want to mention there, is that the information on the paper applications is the same information that's getting requested in the electronic PECOS application. They just look just a little bit different, but they're asking for all of the same information. Instead of section numbers, you'll have titles in PECOS. But that 855I, again, is used to establish a provider, individual provider. It is used to make changes to their enrollment, and that includes reassignments. The 855O, is for a provider who's going to be ordering and referring patients to providers that have filled out that 855I, that they are going to be referring to providers that are billing, but not billing themselves. This happens a lot. I'm going to use VA as the example here, where you have a provider who's maybe practicing at the VA. They're already getting reimbursed for their services, so they're not going to be billing Medicare. They're getting reimbursed through the VA, but they may not have everything their patients need. So they will order and refer patients to other providers that may be billing Medicare directly. So the 855O is only completed if a provider is ordering and referring for services only, but not billing Medicare directly. Why do we need to know about that? We need to know about that because some services require the NPI of the referring provider in order for the claim to process. We need to get that ordering and referring provider into our claims adjudication system. Remember, I said PECOS is building that provider information in that system to get you started. So the O is basically a truncated form that's not all that dissimilar to an 855I, significantly shorter though, because we're not making payments. So that allows us to get their NPI into the system. An 855I, somebody who's billing directly, that's already a part of their enrollment. So their NPI is already in that system. The 855B, this is going to be for your groups and suppliers that are going to be billing claims on that CMS 1500. These are going to be what we would consider Part B. Part A and Part B, the difference is really what system that claim is processing through. So with the 855B, you want to think things like a group clinic, ambulance service, a lab, those independent diagnostic testing facilities, pharmacies, if they're going to be doing roster billing, it's that time of year, flu shots are here. So that's who would fill out that 855B. The 855A, that's going to be for our institutional providers that are billing using that UB04, their 837I transaction. So think hospitals, rural health clinics, FQHCs, again, those institutional settings, largely inpatient, but not always. Again, those rural health clinics, FQHCs may have some outpatient going on, so it just depends. With all of these applications, it's the same form used if it's an initial enrollment, if it is a change of information. Revalidation would only happen on an 855I, an 855B, or an 855A, depending on who's revalidating. You're never going to have that revalidation happen on that 855O because they're not billing Medicare. So there's a couple of additional forms. We did get a question about participating in the Medicare program, and it's a fantastic question. A lot of providers will ask questions about, well, I enrolled, I have my PTAN, I'm participating. There's a difference between enrolled and being a participating provider. The abridged version, a participating provider is accepting assignment and they're accepting Medicare payment as payment in full. And there are some other benefits where we will actually forward your Medigap claims, things of that nature. You'll also get a slightly higher allowed rate versus a non-participating provider who's subject to a limiting charge. But participation is not automatic for most providers. There are some, and this is laid out in the IOM, but there are some providers that are required to be participating. But your MDs, a lot of your non-physicians, your clinics, they do have to make that choice. And so in addition to an enrollment application, they do need to fill out the CMS 460 participation agreement. Like I said, this is optional. It will mean that you will be accepting assignment on all claims. It applies to groups and organizations, suppliers, and individuals that are in private practice. I talked about the one that is the sole owner of their own corporation. They'd have to do this for the corporation, for the group. We do sometimes also see sole proprietors that are practicing under their Social Security number or unincorporated tax ID. If they wish to be participating or accepting assignment on all claims, they're going to have to fill this out as well. It's a really short form. It really just needs address information and a signature. It'll ask for your Medicare or MPI. You can send this in with your initial enrollment and just list your MPI versus your PTAN. That is perfectly fine. But it's just the agreement so that you understand what participating means. Now, you'll notice my note at the bottom. There's a couple times this isn't filled out. If you have an individual who's reassigning their benefits, we do see this come in. You don't need to do that. You're working too hard. Because a person reassigning their benefits has to follow the participation of the organization or clinic that they're working for. They can work for multiple clinics, and those clinics might be a mixture of participating and non-participating clinics. That is okay. That person is reassigning benefits to that clinic, and it's kind of like their parent, if you will, and they're the child. They have to do what the parent says, and they're going to be paid the way the parent has decided they'll be paid. The other instance that doesn't use this is going to be for our facilities, our 855A applications. That is because those Part A facilities are reimbursed differently than Part B providers, and there's reasons for that you'll hear about in our other sessions today. But they will not need a CMS 460. Their payment and that participation concept doesn't exist on that side. The other additional form you may need to send in, and again, this is going to be for individuals practicing on their own, not reassigning benefits, and it's going to be for Part A, and it's going to be for organizations and clinics, is the CMS 588. This is the electronic funds transfer form. This is something that I mentioned. We pay everybody electronically, and they have to fill out this information when they're initially enrolling or anytime the account information is changing. This is what is allowing us to make direct payments to your account. This does need to be filled out with accurate information. This is one of the things that we develop on. We do also need account verification in the form of a voided check or a signed letter from that financial institution. And again, this needs to be submitted with new applications for entities that are getting paid directly. So reassignment of benefits, that individual is getting paid by their employer. So the employer has to do the 588, but the individual does not. There is going to be some supporting documentation that's required with these applications, and that's where that IOM Chapter 10 is going to be really useful. However, I do want to point out to you in our enrollment resource page, there is a section that is specific to provider enrollment documentation, and it goes through by provider and supplier type the documentation that we are going to potentially or likely need. So this is a nice little checklist for you, and it goes through specialty. It's quite a lot of information in here, but it's a nice handy chart that will help you identify what you'll need. So the things that we'll look for: licensure and certifications. It's not going to be the same across the board. That's why we want to leverage that resource. One thing I will point out with some of these systems is that if we can find the licensure verify that information from the licensing or certification body, we can verify that, but we do need to have a copy of that in some instances. We do need to know about their education. So that would be things like diplomas and transcripts. The IRS tax identification number. We do need documentation from the IRS showing a tax ID and legal business name for those entities that are enrolling. Not necessarily the individuals unless they are enrolling as a solo provider, but this helps us ensure that our system has the correct legal business name so that you don't run into issues later, because the IRS does look at our system to make sure we have the legal names and the tax IDs to match. In fact, we can't get you enrolled if we don't match, so we will ask for that. It's also something that we do develop on quite often. I mentioned the bank account information. Another big thing that we see, and this is a development reason, especially now with our skilled nursing facility revalidations going on, organizational structures. When there is an organization and there are, especially if there are parent organizations involved, we need an organizational structure chart to make sure that we have all the ownership reported appropriately on the application. So that is something that you'll want to make sure that you're looking for if you're enrolling an entity. Do want to call out, this is not an all-inclusive list. That's why you want to check out that resource that I just shared with you, because it is going to vary based on what provider you have. So at that point, you're submitting the application. So what's next? So the next thing is you want to check your status. You can do that in a couple of places. You can either do that in PECOS if you submit it electronically. In fact, as your status changes, you're going to get emails if you submit through PECOS. So that's another advantage of PECOS. If you submitted paper or PECOS, we do have what we call our easy screen, and that is an enrollment application status inquiry. And I'm just going to go to that. Easiest way to get to that is to go to Tools, All Tools, and then Enrollment Application Status Inquiry tool. All you need is an application ID, or if you submit it electronically, a PECOS tracking ID. Enter that information. It's going to tell you where your application is in the process. This is pretty real time, so you're going to be able to see it. Certainly, if status changes, you checked this morning, status changes today. It's not that real time, but you are going to see it fairly quickly. Once you get your notification sent to you by email, it is time to bill. The second we send that out, your enrollment should be set up and ready to bill. I will argue that sometimes there is a little bit of an upload delay because, again, PECOS is uploading our claims adjudication system, but we're checking all of that to make sure that that's ready to go in order for you to bill. So when you get that letter, you are ready to bill. All right, so next we're going to talk about PECOS. Now, I did have Mary Sue put a couple things into the chat. One thing I cannot do today, purely because of time, is walk through step by step every facet of PECOS. But we did, in August and September, offer some webinars, and those are the recordings to those webinars that'll walk you through that and hopefully answer a lot of those questions. But we're going to give you the highlights. So getting started. Very first thing to getting started with PECOS to submit your applications electronically is to create an account. This has to happen through the identity and access system, which we're going to talk about in a minute. But I will tell you that if you have an MPI, if you have a user ID and password for the NPES system, you already have your access for PECOS. CMS has structured it so that both systems utilize that same user ID and password. You will need some required information to register, which is going to include identifying information of the user. It may not be the provider, and we'll talk about that in a second, because surrogates and connections, so you can have billing staff that are submitting on the provider's behalf. So it is also possible to just register for PECOS if you're somebody who is going to be a user that only submits enrollment applications for providers. You'll need the MPI for the providers, either themselves or that you're going to be submitting on behalf of, because we do have to make connections between you and your providers in order for you to see their information and to submit information. And then we're also going to need some contact information. The connections, I've mentioned this a couple of times, that you'll set up would be authorized officials. And I just want to point out, authorized official in the INA system is not the same as an authorized official in an enrollment record. It can be, but it isn't necessarily. An authorized official in the INA system, that identity and access system, is somebody that can manage surrogate users and staff users inside of PECOS. So please bear that in mind. Staff users would be someone who has a direct employment arrangement. So think W-2 employees, your billing staff, your in-house credentialing staff. A surrogate user is somebody who has a business relationship, but it would be more like an outside credentialing company or a billing agency. So they function the same, they can do the same things. It's just about separating the user type so that we know who's doing what. So this is what the Identity and Access System homepage looks like. I've included a link to that. So you'll have your item A there, which is your user ID and password. Item B, it's a little fuzzy and I apologize for that, but that is going to be for some additional help. It's also going to be your forgot password. So if you're having trouble getting in, it's saying your password is expired, you do have an option to reset your own password. That is not something that our customer service area handles. This is a CMS system, so we do not manage those passwords. It does also have links to some references there at the bottom. Those links are available when you're on the INA system, and it's complete with screenshots and step-by-steps of how to set up your users and some troubleshooting. Item D is if you need to create an account, you can do so from that INA, and it'll take you through the steps, and it'll take you to what you see on the right side of your screen, which is creating an account. You do have to have a unique email address. Each user has to have their own email address. We get questions about, we have a group email address. Can we set it up under that? That's going to be one user. So just something to consider there. And then you can see those same quick references there. One thing I do want to call out that Identity and Access is not. Identity and Access does not update anything in your enrollment record. The Identity and Access Management System is purely about managing user access. So if you're changing an address and an authorized official in INA, that is not going to update anything on your enrollment record. You have to submit an application for that. Once you have that set up, you're ready to access PECOS. I have included a link here for PECOS again. You do need a user ID and password. When you're on the PECOS home or PECOS login page, you're going to be able to reset your user ID and password if you forget that. But you're also going to see on the right-hand side, there's some helpful links. You can't see the whole page. If you keep going down, there's actually some videos that CMS has put out that are specific to type of application. Highly recommend those in addition to our videos as far as step-by-step completion. Once you're logged into PECOS, this is what you're going to see. You're going to see what you see there for item A is My Associates. This is where you're going to do the bulk of your work. Whether you want to initiate a new application, an application for an established provider that's maybe joining another group, a change application, a revalidation, that's all going to happen through My Associates. When you get into My Associates, that is where you can see your connections, whether that's individuals or groups, and submit applications on their behalf. You can also see application status out there. So as your application is moving through the process, if you submitted it electronically, you can see the status and any developments. If we've sent back a request for development, you can access those there. You can also respond to your development there. It'll give you an option to do that. Item B is going to be Revalidation Notification Center. You can go out here to see if you are up for revalidation. We have heard there's sometimes challenges submitting a revalidation through here. I recommend going into My Associates, locating your provider, and then you will actually see an option, more options button and a revalidate button that'll let you submit that revalidation. Again, I recommend doing all of your application actions through that My Associates button. Managing your signatures. We get lots of questions about how do I sign applications that need to be signed. The individuals that need to sign those signatures are going to see those inside of their PECOS access, so your authorized officials, under their managed signatures. They're also going to get email notifications that they need to sign an application, and then it'll take them through those steps. The other two items here are for account management, that's item D, and then item E is, again, some of those same resources that you'll see on the login page. So as you go through the process, there are resources every step of the way. Actions available in PECOS, we talked about these a little bit. Initial enrollments, you can make changes of information. Again, you can see what we have in our system. You can revalidate, you can manage reassignments, and this is for all applications and all types of providers. Also, some providers, these are going to be our facilities, may require an enrollment fee, and you can pay that fee here as needed. When you get into PECOS, you're going to see a scenario questionnaire. It's going to ask a little information about you. Like I said, I equate this to the do-it-yourself tax software. It's going to ask you questions, and you need to make sure that you're reading through these thoroughly, because you can't change these once you start an application. If you selected the wrong responses and you started an application, you will have to delete that application and start over. So this is going to help you get the sections and topics that you need. This is what that topics page is going to look like. I'm showing you an example of one that's completed, and you'll notice that I've got check marks for all my topics. This is going to be what PECOS is bolting together, and these are the sections of the 855 PECOS application. It's not going to present it to you the same way, but it is asking the same information, what it needs you to provide. Each of those sections does have a more information that will tell you what you need there. So utilize those. It's a lot of great information. You do need to have check marks in all of the sections presented to you in order to begin to submit your application. PECOS isn't going to let you submit an application with missing information. Could be incorrect information, because that's all being vetted when we get that, but you do need to have everything completed in order to submit. You don't see it in the screenshot, though. The other thing that you'll see at the top, you'll get errors and warning messages. Errors are things that have to be corrected before submission. Warnings are things that you might want to look at, but you can submit without correcting. So just keep that in mind. It will ask you, are you sure, on that scenario when you ask those questions. So again, as I said before, you've got to make sure that you got this correct, and that before you are starting that application, you have that correct scenario. This is one thing that we do see. Providers will call saying or submit applications with the wrong scenario, and we can't change that. And so we will need to develop on things. So just make sure that you're reading through that acknowledgement. Now, we did get some questions about managing reassignments, and there's two ways to do it. You can do it through the paper application, but in PECOS, you can do it either through the group enrollment or the individual enrollment. Things to keep in mind, you need to know if your provider is established in the jurisdictional state. If they're not, my advice to you is to do the reassignments through the individual, because if they're not established, you're still going to need to fill out that 855I, everything that vets the qualifications of that provider. Because on a group, you can only manage the reassignment portion of that individual provider's enrollment. And that's for privacy reasons for the provider. So here you are seeing where we have gone into that group, and you can view and manage the reassignments, including adding new providers. You can also deactivate providers. We had a question about providers that were leaving a group, so you can deactivate them through here as well. But you would be going into the group enrollment here. The other way, it's going to look similar, but if you're going through that individual, if they're brand new, you are going to have a reassignment of benefits summary, and it's just the reverse. Through the group, it's going to ask about individual information as far as reassigning. Through the individual, it's going to ask you to fill out the group organization information that they're reassigning benefits to. You can search for existing reassignments the provider has. You can add reassignments. You can make changes to the information on the reassignment, and you can deactivate those reassignments. So a couple of PECOS reminders: make sure that applications are signed. That is one of the bigger development reasons that we see. We do realize the application is getting submitted, and it could take up to 3 days for that authorized official to sign it. So you will see a development on that, but we are monitoring those. So we have to get that 30-day clock started per CMS, but we are monitoring those. So once that's signed, we will continue the processing of that. But make sure they're signed either electronically or you're uploading the appropriate application to PECOS. Make sure you're uploading your documents. As you're submitting an application, you do get the option to upload documents. A couple of tips there. They have to be in a TIFF or a PDF format. We cannot take images, meaning we can't take JPEGs and we can't take PNGs. PECOS doesn't ingest those. And you're going to want to respond to development electronically, especially if you're submitting through PECOS. That is the quickest way because we do check those. I have actually seen where development has gone out within the same day, sometimes in the same hour. If somebody's seeing that email, they're responding to development, and the next day we're starting to work that application again. So again, another plug for PECOS as being the most efficient way to submit. So next, we want to talk about avoiding development. So common errors, and we've already talked about some of these already. Signatures, whether that's a paper or an electronic application, we're either missing signatures, we're missing signature dates, or the wrong person is signing an application, particularly with authorized delegated officials. Make sure the right people are signing those applications. We're missing an application. So I mentioned the reassignments. If you're submitting them through the group, make sure you know if that provider is even established with us. If they're not, we need 855I. So that is one of the things that happens. We need the whole new application in addition to that reassignment. Supporting documents. I mentioned that tax document. Those are things that we miss. The organizational chart. Maybe we are missing the CMS 460 or the CMS 588. Before rejecting an application, we are going to work with you. We're going to develop and give you that opportunity to get it right and get it through the first time. But if we develop, you have 30 days to send that in. It is going to slow down that processing time a little bit. We're working those in the order those are received back. So the cleaner the application comes in, the quicker the process. The other common error is kind of across the board. It can be various sections, but incomplete or inaccurate sections. Maybe we have a practice location that has inaccurate information or it's incomplete. Maybe we're completely missing section 3, which is adverse legal action information. That has to be completed on every application. So those are the kinds of things that we are typically developing for most often. Here I have just included a list of the documents, and we've talked about these, but the documents that we are most often missing if we need to develop for documentation so that you have that. For the sake of time, I'm going to keep us moving here. So some reminders. We want to make sure that all required sections or topics, if you're doing this through PECOS, all required sections are complete. PECOS is going to help you avoid missing a required section, whereas with the paper application, it does tell you what sections, but you're going to have to navigate those sections on your own, or PECOS is going to present them to you. Make sure we have the correct contact information. We did get a question about development and those notification letters being sent out to the contact information. You can have multiple, but we're only going to send it to the one. So if there's somebody that this needs to primarily go to, you can put that in the application or give us a note telling us make sure it goes to Sue before it goes to anyone else. But we can't talk to anybody about that application that isn't listed on that application. So if you have a team, it is okay to put multiple people in as the contact. Add our emails. So we have a PE Medicare email, but PECOS also has a CMS email that they send a development letter out. Add those emails to your safe sender list. We do see instances where our development letters and even the notification letters are going into junk and spam folders, and we can't control that. So we do need your help there. We talked about signatures. You do need signatures on all applications. If we develop for you to make a change to an application, electronic or paper, we need a new signature because you need to certify that everything on that application is true. So that's one thing that we do see. We'll get development back. They made changes to an application, but we didn't get a new signature. So now we've got to reach back out and develop for a new signature. So if we develop, it's something other than documentation, it's something on the app, sign it. Make sure you're reviewing those development requests carefully to provide us with everything, and make sure you're responding timely. Okay, so the next two slides, I have provided a lot of resources, many of which we've talked about today. But for the sake of time, I want to check in with Mary Sue. I know we won't get to all the questions in the chat. I want to get to a couple of them. I will be sending out a follow-up document though, and we'll be addressing all of those questions. I also know my team's been answering some of those along the way, so thank you to them. Mary Sue, can we get a couple of questions from the chat, please?
And there's been some kind of common questions about enrollment and enrollment, let's see, for multiple facilities, or if someone's already enrolled, you know, in one place and they need to enroll in another, how is that done? So if you could kind of just re-go through that process maybe a little.
Yeah. Absolutely. So a provider can be enrolled with multiple facilities at the same time, and they can be billing for practicing at multiple facilities at the same time. They just need to be enrolled under each facility. Those facilities are going to have likely group PTANs if we're talking about a reassignment situation, which I believe we are, and they're going to need to enroll for each group PTAN they will be practicing under. They do that using the 855I application. Remember that 855R has been decommissioned, and so that reassignment information, if you're familiar with that previous R application, was incorporated into that 855I. They can actually reassign benefits to multiple entities at the same time. It's structured so that they can fill that out and tell us who they're reassigning benefits to. The provider has to sign the application, but an authorized representative from each of their organizations has to as well. But they can absolutely enroll that way. Let us know who they're reassigning benefits to. And what we will do is we will assign what we call a group member. That's that reassignment, a group member PTAN for that provider under each of the organizations they reassign to. So that when their claims come in with their MPI, our system can look and make sure that we're paying the right organization. With that, I hate to do this, everybody, but I want to be respectful of everyone's time. I am going to be responding to any unanswered questions in the chat in a follow-up document. I saw some really great questions coming today. We're going to make sure you have those answers. But I do want to be respectful of your time, and I do want to follow up. Certificate of Achievement, if you're attending today for continuing education credits, you're going to get an email that's going to allow you to take our survey and provide us with a little bit of feedback, and then also serve as your Certificate of Achievement. If you don't get that, Mary Sue's going to put some information in the chat that's going to allow you to reach out and let us know that you need that. I will also ask, though, that if you attended by phone, that you put your phone number in there so that I can verify your attendance and get that out to you. I will be, in addition to answering those questions in the chat, I will be taking follow-up for the next 7 days. So go ahead and send that to that education mailbox. Just be sure that you're putting the title of today's session in the subject line so that those that are watching the mailbox today know that this is from my session so that I can get you answers. I would appreciate all of you taking some time to provide us with some feedback. I know nowadays you seem to get a survey for everything, but our survey is very important to us. It steers all of our education, and it's our direct feedback loop with you. So tell us what you liked, what we can continue to do to support you in navigating your journey through Medicare. Let us know what we could do better. But this is also, today's session is geared towards newer providers and that life cycle of a claim. So if you're newer to Medicare, what topics would you like us to see? This is how we get your feedback so that we make sure that we're doing what we can to support you and give you that best possible experience. With that, I know I went just a little bit over. I want to thank everybody for taking the time to attend today. I know sometimes we're super busy and it's hard to carve out this time. I hope you found this useful. On behalf of myself and the entire provider outreach and education team, I'd like to thank you for attending today, and I hope that I see you in some of our other sessions today. I think you'll find those very useful. Everybody have a great rest of your day. Enjoy your sessions, and you can now disconnect.